Are you still struggling with those spikes in your glucose levels and finding it difficult even after making changes to your medications or making changes to your diet? Well, here are some tips that you can take in terms of trying to lower your glucose levels. First of all, what you can do, look at the size of your plate. So ideally, you should have like a 9-inch plate having your dinner from. And then what you should do, half of that plate should contain non-starchy green vegetables such as broccoli. A quarter of the plate should contain carbohydrates, and then another quarter of the plate should have lean protein. Now, in terms of eating, try and start with your fibers and then your whole grain, because your whole grain helps glucose to absorb much more slower into our bloodstream. Then you can look at after you eating, try and keep moving after you eating for 10 to 15 minutes. It doesn't have to be vigorous exercise, just light walks or doing some chores around the house, because in that way your muscles absorb the glucose to prevent those spikes in your blood glucose levels after you eating. Then you need to make sure that you hydrate yourself. Hydration is very important. Try and have 6 to 8 cups of water per day. But if you're someone who's have any cardiac issues or any kidney problems, then please speak to your doctors, because you may be on some form of fluid restrictions. What also you need to look at, in terms of your sleep pattern. Are you getting enough sleep? Are you very stressed? Because some of these things can also elevate blood glucose levels, because when you're stressed, that there's a hormone called cortisol increase your glucose levels. What also you should look at is your meal pattern. Are you eating too closely together? For example, if you have breakfast at 10 o'clock and then you go and have lunch at 12 noon, then that's very close together to have your meal. So try and space your meal out as much as possible. And within those meals, try and have your balanced diet, including your carbohydrates, your protein, and your fibers. So always remember, it is the small changes that counts. It is not the quick fixes, because very small changes equal to greater results, as I have seen when reviewing my patients on a day-to-day basis. So remember, diabetes, it is a marathon, it is not a sprint. So good control, good health, better management.